Some of the questions I get asked as an orthopedic surgeon dealing with sports medicine injuries is about shoulder dislocations and how we treat them. So to understand how we treat them, we must understand what happens in a shoulder dislocation. So the shoulder is a ball and socket joint, and the socket is fairly small and flat, and the ball is fairly large in diameter, and therefore it can easily slide out of the socket. And what prevents it from sliding out is a structure called the labrum. And this labrum is like a rubber O-ring that goes around the socket, and it cradles the ball and stabilizes it within the socket. When a shoulder dislocates, it almost always dislocates to the front, and it detaches the labrum from the bone. And usually that labrum does not heal back to the bone of the socket. And what that means is that you might be left with an unstable shoulder, and you could have a recurrent shoulder dislocation going forward. So we have done studies, and through our studies we understand that there's an age-related correlation with shoulder dislocations. An 18-year-old will have a 90% chance of recurrent shoulder dislocations. And so therefore those patients are treated almost always surgically to repair that labrum back down to bone. But as we get older, the recurrent rate goes down. So somebody in their 30s will have a recurrent dislocation rate of about 50% to 60% or so. Still high, but it's something that if you're not a high-level athlete, we can treat non-operatively with physical therapy. And as we get even older, that recurrence rate goes down even lower. And those are usually treated non-operatively with physical therapy.